Catalyst is an alcohol rehabilitation program. Unlike other programs, it's a non-residential program, so people come every day. And it's for people who want to change their alcohol use, so either reducing their alcohol use or for people who want to stop using altogether.
My name's Trevor King, and I've been working in the alcohol and drug sector for many, many years, over 30 years. And I've got a particular interest in how you translate research evidence into good practice. So this project was absolutely up my alley. I thought this organisation was one that was able to take on new ideas.
The real strength of the Catalyst program is that it's evidence-based. We conducted a thorough literature review both nationally and internationally looking for what works in treating alcohol dependence and preventing relapse. And we've incorporated that knowledge and those learnings into the development of the resource manuals. The resource manuals were developed and refined over the first couple of years of the program, with education and training staff working very closely with clinical staff delivering the program and also with the clients to refine and develop the materials over that time. And what we've ended up with is something that incorporates best practice and is backed up by evidence of what works.
The program itself is quite varied. We have very structured sessions, psychoeducational sessions on CBT and mood management, but we also have a number of other sessions that are less structured. We've got yoga and gym, got financial education and strengthening relationships. We've got 2 job network agencies involved. We have a nutrition, we have drumming and relaxation, and art therapy, which is what I do within the program itself.
So there is an aftercare component where graduates of the program can attend Momentum, a weekly support group, but also can mentor new people coming into the program and offer their experiences and some idea of what the program is going to be like, but also provide information and input to Moreland Hall as to anything that needs to be changed about the program.
So the Catalyst has had both an internal and an external evaluation process. The internal process is really focused on what clients' experiences have been like, gathering a lot of qualitative feedback on just what the impacts have been for people during the 6 weeks of the program. The external evaluation has focused more on gathering quantitative data, focusing on areas like this includes both pre and post testing during the program and then 6 and 12-month follow-up calls. What the 6 and 12-month follow-up has really shown is that the quite significant improvements that people are getting across a range of fields, including their alcohol use, other drug use, social functioning, mental health, physical health, are really maintained in the long term. And while the improvements in relation to substance use are maintained at a good level, for things like the mental health, physical health and their family relationships, they actually continue to improve beyond where they were at the point that they left the program. So there's a really good indication that there's a real sustainable benefit associated with participation in this program.
Well, I think if you talk to clients about why the program's been successful, people really appreciate that they're learning new things and able to go home and practice them in their real environment. So going home each day and being in contact with their families and friends. But also because it's a non-residential program, if someone does actually lapse during the program, they don't need to be excluded. And so not only that person, but the rest of the group can look at that relapse as an opportunity to learn what happened and how can they plan things differently. It's also relatively short term. It's a 6-week program, so that's doable for people who work or who've got family responsibilities. And there's an aftercare component which is helpful for people keeping in touch with the group that they've identified with through the program.
Catalyst has been a great creative project to be involved in. It's wonderful to see these changes in the clients, and it's a rare commodity today to be able to come to work and say, I really love my job and I enjoy being with the team and the clients.
Catalyst has been operating for nearly 3 years now as a pilot program. The program comes to an end at the end of June 2012. Moreland Hall is really hopeful that this program will be refunded by the state government, because certainly the results and effects that this program has had on people who've partaken in it has been quite substantial and effective.